Many times my patients are dealing with tragic events, whether it is the loss of a loved one, loss of their health, loss of independence, loss of a limb. Many things can be tragic and kind of irreversible. These are 5 different stages. And the only thing I can tell you is the first stage and the last stage are pretty much common to occur in that order, first and last. The 3 stages in the middle can go back and forth, and this is a process. The first stage is, and by the way, this is written by an author, Elizabeth Kubler Ross, a very well-known psychologist who wrote a book called On Death and Dying, and this is from that book. The first stage is denial. This isn't happening. This didn't happen to me. My spouse didn't pass away. I don't have this diagnosis. Just the denial of what actually occurred. The second stage is anger. Once it's come to the realization that this has occurred, people can get angry. How did this person leave me? This is not fair. This shouldn't be happening to me. I take care of myself. Why didn't they pick up on this sooner? All of this is anger. The third stage is bargaining, which is looking to your higher power and saying, I will change my life. I'll do everything I need to do. Just please make this go away. And it's a bargaining. The fourth aspect is depression, which is one of the common things and sometimes lasts the longest period of time. You can't not go through depression. It's part of the process. The final stage is called acceptance. When we move past this, accept what has occurred and then learn how we can live through that or beyond it. The problem occurs when people get stuck in a stage, they're not permitted to move through to the next stage, or they feel like what they're going through is abnormal and will never stop. The typical time frame, especially if it's a death of a loved one, is 3 to 6 months. It doesn't resolve overnight, and it takes that time. Sometimes help is needed professionally, sometimes time is just needed. The thought of time heals all wounds may be trite, but it's absolutely true. That doesn't mean that whatever occurred it will be forgot, or it doesn't, not that it means anything less, but acceptance means I know this occurred and I'm going on with my life. The other day I had received an email from an elderly patient's daughter stating the symptoms that she was concerned about. He was isolated himself, wasn't taking care of himself, and wasn't eating, was really just neglecting his own health. And we knew it was from the passing of his spouse that he'd had for decades. When the patient came into my office, I was able to describe to him how the normal process of grieving occurs with appropriate pauses to let this person let me know how he related to this and how his anger was where he was stuck right now. Because of the time that we were able to give this individual and the trust we built over the last several years, he was able to share with me these feelings. And I acknowledge that these are not right or wrong, they just are. And with that, he started to understand his feelings and that he did need some help in dealing with them, because if he didn't, he wouldn't get to acceptance and he wouldn't be able to enjoy the life of his children that he had with his wife or the life of his grandchildren, and he'd be missing out on life. Many times people need to be reminded that their spouse wouldn't want them to ignore the rest of their life without them. They would want them to go on and share the time they have with the rest of their family.